Welcome back on the AM show. It's the 1st of April edition, and this morning we're talking vaccination a month on. It's a conversation on the lessons we've learned so far and the way forward. And joining us for this discussion, we have Dr. Yao Bediako. He's an immunologist with WACPIP of the University of Ghana. There's also Professor Alfred Yorson, Head Community Health at the University of Ghana Medical School. And also joining them, Dr. Fred Amwaku-Boateng, Bono East Health Director. Yeah. Well, those are the ones we have on board, Gifty.
Yep. And they'll all be joining us via Zoom, and we want to hear from you as well. What has your experience been? Well, that's Dr. Bediako right there. But like I said, we want to hear from you if you're joining us on TV. What has your experience been? What do you think? Do you have any questions for our resource persons? Bring them in. We'll throw it all the way to them. Interaction with you is key, so we'd love to hear from you. And we'll also be bringing you details from other regions as well, other places, to find out what the drive has been like. Gifty, only yesterday, and I'll be going to Dr. Bediako shortly. Only yesterday I was speaking to an elderly woman. She's above 70, and she was telling me, I think she's in Techiman, where she finds herself. There's practically no talk about this vaccine and what is happening and all of that. And I was asking, so what's going on in other parts of the country? She made it seem like an Accra thing. There was actually a report from, I think, our Bono regional correspondent about the region taking stock of its vaccine, I think last week or this week. So maybe it has landed now, and they'll be hearing more about it. Dr. Bediako, it's good to see you. Good morning.
Hello, Dr. Bediako. I think you might have to unmute. Right. Okay, so it's refreshing to have you join us for another discussion on vaccine. And to be very honest, we're not sure who to start the conversation with you, but I'm nominating Benjamin Akakpo. All right, so I accept the nomination, Gifty. So let's start the conversation from here. We took our first batch of, first tranche, if I would put it that way, of vaccines, 600,000 of them. And we've been told that, we've crossed the 500,000 number. So at least for this first batch, we seem to be doing fairly well in terms of the numbers, in terms of our general population and all of that. But how do you say so far, Doc, we fared in terms of the vaccination drive, in terms of maybe even all the conspiracy theories? We can't help but keep talking about them because they keep coming up. What would you say?
I think we are doing quite well. We vaccinated a good number of people. I think considering how many vaccines we received, we have almost exhausted that supply. And I think we've done so very quickly. So I think compared to many African countries that actually had a significant lag, we have done quite well. Yes, the conspiracy theories abound, but I don't really think that those have affected the rollout in Ghana. I think, we don't yet have saturation. It's not like we had millions of vaccines to give out and they were going to waste. We've handed out 500,000 out of the initial 600,000 that we received. My understanding is we've received a small consignment subsequently. So I think on the whole, you could give us quite a good grade as far as the rollout has been concerned. Of course, there were some hiccups. There were some questions about if the right people were getting them. But I think with a situation like this, you have 20 million people. So far, you vaccinated 500,000, so a little bit more than 1%. I think we have done quite well. The challenge we have is continuing the drive. You cannot lose momentum. You cannot run out of supply. And some of this is beyond the control of our government. There are currently sort of delays that have been generated because Serum Institute of India has, basically the Indian government has restricted exports till they are able to vaccinate a certain number of their own people. And that is going to affect our supply through COVAX. I think now COVAX is saying it will be the end of May before they can deliver, when before they were hoping to have delivered earlier. There have been disruptions in Europe surrounding vaccine availability. So we're not out of the woods. We've done well with what we had. but we need to secure another, million or so doses to keep the drive going. And then obviously we need to get up to 40 million doses somehow. And that is going to take some careful diplomacy and a lot of, strategic planning from our government, from the private sector, to simply secure enough vaccines. But I think for what we had, I was actually quite impressed with Ghana's response. Our president, vice president got the vaccine a day after they arrived. There are countries where the president, the government officials did not get the vaccine till 3-4 weeks after vaccines arrived, which didn't make any sense to me. So I think in that regard, we have to give credit where credit is due.
Okay.
The challenge, though, is continuing the effort to continue to get enough vaccines into the country.
Okay, so the UK is doing pretty well now on the back of the vaccination drive. Their COVID-19 numbers have plummeted, and even those who are in critical condition in hospitals have also plummeted. So they're doing pretty well. You look at our numbers, and our active cases right here in Ghana have fallen below the 2,000 mark, and it shot up initially from the end of last year into the start of this year. Would you attribute that to the vaccination drive?
No. We simply have not vaccinated enough people to have any effect yet, or that scale of an effect. I mean, the UK has so far vaccinated well over 25% of their population. So when you get vaccination levels to that level, and of course they've been doing it in the most vulnerable population. So 25% of the total population, that means they've probably almost covered everybody in certain age demographics or certain risk groups. So of course they're going to see declines in burden. And of course, there are some people in the UK who've received 2 doses. No one in Ghana has received a second dose, which is the only way you get sort of the highest level of protection. So this drop is probably more a result of maybe better adherence. The spike was due to the foolishness that happened around Christmas. And I think what we're seeing is the end of that. And because of the fear and the realization of how serious the situation was, I think adherence to the guidelines has been a little bit better. But the pandemic tends to move in waves. So we cannot also be overly, we cannot be complacent. This drop, it's partly due to our efforts, but it's also partly probably due to just the natural cycle of the virus. There can be another wave. A lot of countries are in the midst. Kenya is in the midst of a third wave. And so there's nothing, there's no reason why Ghana could not have a third wave if we're not careful. So I don't think this is a vaccination. This is probably a little bit better adherence than we had in December, and also probably a little bit of a natural waning just in general. But, Easter is going to be critical. If we behave like we did at Christmas, then I would predict that in May, we'll be back where we started. If we behave better and are more sensible, then hopefully we can keep the levels relatively low as we continue to try to vaccinate.
Dr. Bediako, I like the way you put it, more sensible and the foolishness. Those are very interesting words for us here in Ghana. So I like the way you use it. It sounds to me like someone speaking in very critical terms, like this is it. It's a give or take. You either do it or go away. So let's take a little look at the timeline. You talk about May, COVAX indicating that we might get the next tranche in May. To what extent will, because I know that when you take the first dose, there's a certain period within which you have to get the second dose. To what extent will that May timeline affect the rollout of the vaccine the way it should?
So currently in Ghana, the preferred timeline, or the timeline the Ghana Health Service has laid out, is 8 weeks between doses. So for people who got it sort of in March, you're looking at 2 months, right? So you're looking at sometime in May. Now, the data suggests that you can push it all the way to 12 weeks. In fact, the longer you push it, the better. The data from the UK, because initially everybody was doing 21 days in between. Then data came out from the UK showing that if you delayed with the AstraZeneca vaccine, if you delayed the interval, you actually achieved better protection. Okay. So it goes up to 12 weeks. So even though the Ghana Health Service preferred interval was 8 weeks, the reason they did 8 weeks was they were worried people would not show up. If you push it too long, people will forget and not come for the vaccine. So we actually have some buffer. If we push it to 12 weeks, that's putting us, most people got vaccinated in March, so that's putting you somewhere end of May, early June. So if COVAX delivers when they are hoping to, which is sometime in May, we would still be okay. The issue is if COVAX suffers yet another delay, if India refuses to export more vaccines, then we have to look at other sources Of course, there are other ways to get vaccines. We've heard of, Sputnik 5. The challenge there is we've started vaccinating some people with AstraZeneca. There is work currently going on to see if you can mix and match, because AstraZeneca and Sputnik are actually very similar types of vaccines. So those ones, you could conceivably think that you could probably get a second dose from Sputnik and still be fine. But currently that trial has not, that data is not there. So the current guidance is to stick with the same type of vaccine in your 2 doses.
Yeah.
But if I may just chip in, Doc, if I may just chip in, generally, when it comes to mixing vaccines, what are the pros and cons of them? Because I know usually you wouldn't want to mix them. You're saying there are similarities between AstraZeneca's vaccine and, Sputnik V. But even without the trials, would it be advisable?
It's not advisable. Well, without the trials, you don't like to do anything without having data. It is not inconceivable that it would be fine to mix. There is actually good evidence suggesting that you may actually improve the efficacy of the vaccines by actually combining them. So, as I said before, vaccines typically, they don't quite work the same as medications. Certain drugs don't go well together. Vaccines are a little bit different. But I don't think it will be harmful. The issue is, would it be as effective as if you had AstraZeneca 1 and 2? All the data we have on AstraZeneca involves AstraZeneca first dose, AstraZeneca second dose. All the information we have on Sputnik is Sputnik first dose, Sputnik second dose. So that's why we need to do, and I believe that I saw, a couple of months ago, Gavi was talking about a trial, or they were discussing a trial to compare using AstraZeneca for the first dose and Sputnik 5 for the second dose, because they recognize that vaccine demand is going to outstrip supply, and you may have situations that require mixing. So it's not something, we should do till there is conclusive data that it works. But if the data does become available, we shouldn't be worried. I wouldn't, once there's data that it works, I really don't think it will cause any harm. I just want to know that it will work. And so if they can get some data to show that, then that at least opens up another avenue. But for now, we are hopeful that COVAX will deliver. And we are also hopeful that through bilateral agreements, through the African Union, we will be able to secure other vaccines. But yes, the issue of mixing and matching has not yet been, concluded. And so for now, we have to try to secure enough of one type of vaccine to vaccinate a certain number of people. And if you switch to another vaccine, then you put those other people on that other regimen. And so it makes the logistics even more complicated for our Ghana Health Service.
Situation and all of that we could end up with Sputnik V. And mind you, AstraZeneca and Sputnik V have both been approved by Ghana. So we could end up at some point, if it gets to the worst, with this kind of mixture. But let's even talk about the Sputnik V. I just want to find out, because at least for AstraZeneca, we know that, like they've said, even the longer you delay between the doses, the more effective it is. And when you get the second dose, it becomes so much more potent. Looking at Sputnik V, have they conducted those conclusive tests on that vaccine? As of this time, there are still question marks about the Russian vaccine. What is the latest that you can tell us on it?
So for what I know about the Sputnik V is it shows very good efficacy in the phase 3 clinical trial. The only caveat is that was conducted almost entirely in Russia, whereas AstraZeneca was actually trialed in Brazil, the UK, and a small trial in South Africa. So AstraZeneca has been tested in more diverse geographic regions, and that has some, that does carry some weight with me, because geography, ethnicity can affect efficacy. But having said that, Sputnik V had an efficacy of over 90% in its trial. So even if it dropped a little bit in Ghana, it was still 80% or 75%. That would still be very, very good. So I don't think there's any concern there. In terms of the interval, I'm not sure if they have sort of done the testing. I would suggest that it would be very similar. The actual vaccine, if you look at the biology of the two vaccines, they're very, very similar in design. They are both viral vector vaccines. The AstraZeneca one is a chimp adenovirus, whereas the Russian, the Sputnik V, is a human adenovirus. So they are very, very similar in design. You could think of it as a Honda and a Toyota. They are all, they look, they are both Japan, they are quite similar in the way they look, and still the way they work. Okay. So I think that probably the interval, if you had to wait 8 weeks in between, I think would probably still be fine. Yeah. Even though I'm not sure if Sputnik has been trialed, they've got the data to actually determine that conclusively. Okay. But based on the similarities, I think we can assume that it will still be okay.
Okay. Dr. Bediako, I have a few more follow-up questions, but let me welcome Professor Alfred Yorson, who is Head of Community Health with the University of Ghana Medical School. Doc, thank you so much. Good morning.
Good morning. And good to be here.
It's good to have you, Doc. I also have Dr. Fred Adomako Boateng, who's the Bono East Regional Director. Doc, thank you so much for your time. Good morning once again, gentlemen. Okay, so Dr. Bediako, I have a follow-up question about what we should be doing within the time. I get that Ghana isn't running its own, trials that would give us any concrete data when it comes to mixing vaccines. I don't think we're there yet, and I don't know if we can, because I don't think we have the Sputnik yet, so that we can try Sputnik and something else and ask for volunteers, like we did at the beginning, at the initial stages of the vaccine development. I don't think we're there. But between the first dose that have been given and when we expect the next, what should typically a country be doing, a country going through this vaccination process be doing in terms of education?
Well, I think we have to keep educating the population on the need for vaccination. We've only done 500,000 people. We have, 19.5 million people to go. And so we have to keep, we have to use the fact that we vaccinated 500,000 Ghanaians and they are all still here. I am one of them. I suspect perhaps some of us on this show have also been vaccinated, and we are fine. Yes, we had some, I had a fever and a little bit of pain, and was basically sleeping for 24 hours. Oh, but wow. That was, a normal response to the vaccine. It meant my immune system was responding, and I'm fine. So I think we have to spread the word that, look, the vaccine is safe. There were a number of people who were worried. Is it safe? Why should I get it? We can use the fact that we've done 500,000 people. The world has done almost 400 million doses. We should use, in fact, maybe even more than 400 million at this point. We should use all that evidence to say, look, 500,000 Ghanaians, including our head of state, have received this vaccine and are fine. 400 million people around the world have received COVID-19 vaccines and are fine. And so now it should be, you need to get this. When we get vaccines in the country, when we have them available and they call your name, go get your vaccination. And in the meantime, let's continue to adhere to the guidelines. Okay. Because we've got one shot, we're not fully protected, and many people have not received any vaccination at all. Yeah. So we have to still adhere to the guidelines just like we were in January. But obviously push the need to get people vaccinated as and when the vaccines are available.
Let me bring you in, Prof. Yorson, Head of Community Health at UGMS. Prof, one of the key things that has happened is that we're managed to use, the president himself, his vice, persons in the media like myself, we've all gone out there vaccinated. What is your assessment when it comes to our ability to get this well-rounded, inclusion in terms of this vaccination program? Your assessment from a public health perspective.
Yes, there is always what we call vaccine hesitancy, and it's always going to be the case. Whenever you are introducing a new vaccine, even for the expanded program on immunization that we have for the children, when we were introducing the second dose of measles, rubella, it was the same, it was challenging when we were introducing the meningitis A at 18 months. So every new vaccine comes with that, and it is expected. That is why it is important that public health measures in terms of risk communication and health promotion activities are done. So far, we've done very well, as I will say. We've got people who have vaccinated and are testimonies. I know Fred here has vaccinated, I have vaccinated, I vaccinated. The next day I went to conduct exam and I went through with a few headaches here, fever there. And these are examples. We have vaccinated older persons, we have vaccinated medical students, nursing students, other young people. So we have a profile of the population that we need to vaccinate, of the 20 million population we've targeted. So far, we have vaccinated a profile, like a sample, and these 500,000 people are there with no major untoward event. So that is a platform that we can stand on to educate the whole country that it is important, it is safe. And I must say, all these events are following immunization were expected, were in the dossier that was presented to the FDA for it to approve. So everything that is happening is not unexpected. We expected this to happen. And so we should be confident and go forward to take the vaccine as a nation and as a country, so we protect one and each other.
Well, Prof, let me also find out from you. Ben here, by the way. Speaking earlier to Dr. Bediako, he made mention of the possibility of a third wave if we get reckless, if we fool around. How much of a reality is that? We've had the Ghana Police Service come out with regard to Easter celebrations, the impending ones. We've had religious organizations talk about it as well. What is your take on what we should be doing as we get into Easter? Tomorrow is Good Friday.
Yes. There is always the risk, especially when we are experiencing new variants and strains. You never know what these strains and how they will behave. And also, we know that it is those mass gatherings, those activities are high-risk activities. And therefore, whenever you are going into a season or occasion that potentially bring people together, then the education and the enforcement must be increased. So it is right. We agree with the police, we agree with Ghana Health Service, Ministry of Health, all the communication, and also with some of the traditional and local authorities who have put in measures to reduce the tendency for people to come together. We don't want to get back to where we were in January after the Christmas festivities and all the national events that took place around that time. So it is so important, and you are right, that we need to continue to let Ghanaians know that even though we've started vaccination, as Dr. Bediako said, all measures that we have put in place should continue. And if we let our guards down, we will get into where we don't want to. And now that we are on a good trajectory, new infections are coming down, we are getting vaccinated, people are more confident, health workers are more confident to do what they have to do. We should maintain the pace and go along without creating any unnecessary challenges for ourselves by being over exuberant and doing things that we don't have to do. And everything should be done in moderation.
Uncle Boateng, Bono East Regional Director, the region received, and help me if I'm mistaken, the region received your tranche, was it last week?
Yes.
Right. So I am wondering, as someone who is sitting here in Accra, thinking that we got the first, we got the tranche, was like 2-3 weeks ago. Why do you think yours just came in?
Thank you for giving me this opportunity. You remember that there was a need for us to prioritize who actually got the vaccine. Mm-hmm. In the real world, what we were expected to get, we didn't have maybe the resources. So in terms of the amount that was coming, there was a need for us to prioritize. And I think it's obvious looking at the data, you can see among the 16 regions, those were highly hit. So it was obvious that actually they were prioritized for them to get. Okay. But in the same prioritization, realize that I can give Bono East as an example. Our population is about, let's see, a little over 1 million. The health workers here, we are not even up to 5,000. So the population, in terms of percentage-wise, health workers, we are accounting for less than 1% for the population in Bono East. But surprisingly, if you look at those who suffered from COVID-19, out of the over 1,400 that we got, 33% of us were health workers. So you can see that we were highly hit in terms of this pandemic. And then we actually also fell in the criteria to be prioritized. So, Ghana Health Service, Ministry of Health, every health worker was prioritized to get this first consignment of the vaccine. And in organization and arrangement, you needed to plan very well, and that's how come we got ours. But I have to admit that I am really surprised with the way people are coming for the vaccine. 1.8. But if you look at the current cases that we are having, a total of 682, the number of deaths that we have recorded are 10, giving us a case fatality rate of 1.5. It means that how we are actually managing the second wave is better as compared to the first wave. And the cases that we are getting are more of the moderate, the mild, and the severe. This is what we are experiencing in Greece in terms of the epidemiological nature of COVID-19.
Let me come now to Professor Yorson, but before I do so, let me also just mention that you can call that number 0302-211-691 extension 2, 0302-211-691 extension 2. Before I come to you, Prof, we have Al-Hassan in Nerebehi. Al-Hassan, good morning.
Good morning, sir.
So thank you for joining the conversation. What are your thoughts? What would you like to share with us this morning? And if you have any questions, you can go ahead.
And then I would say a very good morning to your cherished listeners and then your crew. Yesterday, the first gentleman of the land, His Excellency Nana Addo Akufo-Addo, launched this operation of curbing malaria, TB, and one other infection. But I don't know why Ghanaians are paying more attention to COVID instead of that area. So I was really impressed when the government initiated that policy of curbing HIV/AIDS, tuberculosis, and then malaria. But I don't know. I want the government to also know that Ghanaians are dying out of accidents, road accidents, CSM, cerebrospinal meningitis, the tuberculosis, more than the COVID. And so if attention is to be given, it should be rather focused on those areas other than the COVID. Because I don't know if we can compare the accident mortality ratio and then COVID mortality ratio, you realize that people are dying out of road accidents as compared to COVID.
Right.
So please, the government should also try and focus on that area. And we are also pleading to him that COVID has got nothing to do with Ghana, and he should bring back our two sports. Because one way of curbing COVID is by having, effective and efficient immune system, and that can be done or that can be achieved through physical activity. And so the government should also do well to bring back.
Thank you, Al-Hassan. Thank you very much. And you're saying that apart from COVID, there are other major issues we're facing as a country as well that we ought to turn our gaze to. Majid is in Tamale. Majid, good morning.
Yes, good morning. Good morning.
What are your quick thoughts for us?
Hello.
Yes, Majid, what are your thoughts?
Yes, my thoughts are that I have two issues. One is the slow pace at which the vaccines have been rolled out. And I want to find out how they could get it speeded up. The second thing is that, the second issue is that I recently read on The Guardian UK, they were trying to say that there are issues with people who are pregnant and those who are anticipating pregnancy and all of that. And I also heard some of the countries like in Europe, France, Germany are holding on to the AstraZeneca vaccine, largely because of fear with people with underlying conditions and so on. I just want to find out more if there is any information that could help us with it.
All right. Majid in Tamale, so at least as far as we know, in Germany, they are restricting the use of AstraZeneca to over 60-year-olds, and that's what they have decided based on their research. In the UK, to the contrary, that is not what is happening. It is more being used on a more widespread level. But that brings me to the other bit you made mention of, which was actually my next question to Professor Yorson. Prof, in some 17 countries, studies have been conducted, and they point to the fact that maternal mortality and stillbirths have increased with COVID-19, those who are affected by COVID-19. Generally, in Ghana, what can you tell us about this? Has there been any study conducted to find out what the impact of COVID has been on such peculiar groups?
Currently, as of now, I don't have any empirical evidence to show numbers. But generally, we've noticed that when some pregnant women contract COVID, it becomes quite severe. And therefore, the key principle is to prevent these from getting infected in the first place. But in Kolebu and other health facilities, yes, women who are positive for COVID have even had surgery, cesarean section to save both mother and baby. So from the evidence on the ground, not published though, I don't think we have seen any increase in maternal mortality or infant mortality as a result of COVID.
Okay.
Unfortunately,
but Prof. Yeltsin, just to chip in, but you are confirming that there have been cases where pregnant women have had it pretty rough because on account of COVID. That you are confirming?
Yes, there have been cases like that, yes.
Okay. So go ahead. You had wanted to make a point. I want you to wrap up on that point.
Unfortunately, we said this group of persons, the pregnant women, were not included in the clinical trials leading to the approval of the vaccine. So for us as a country currently, we are not including the pregnant women in the target population or the group that we vaccinate. As evidence and science evolve and we go forward and there is evidence that it is safe to be used in pregnancy, especially after the first trimester, then these groups, we put them in the phase 4. These groups and probably children can also be included. But on the large scale of things, so long as we vaccinate enough of the population to reach the herd immunity as we are anticipating, some of these groups will be protected automatically. And therefore, we need to encourage ourselves. Now, I think the main challenge for us is getting in the vaccines because systems are in place to roll it out. The challenge mainly at the national level is getting in the vaccine. Right. We get in the vaccine, we immunize quickly the many people that we have targeted to immunize because it is important to do so. Now that we know our predominant strain is the UK variant and the AstraZeneca vaccine is useful, we need to do that immediately and quickly before any other strains that might not be so predictable appears at the population level. So we need to work quickly and as possible to be able to go through the timetable that we have scheduled for ourselves.
Gentlemen, please stay with us. And Gifty is going to engage Francis, who's calling from Hohoi.
Okay, Francis, how is Hohoi this morning? Talk to us, Francis. What are your thoughts when it comes to the vaccination process? Do you have any questions for our resource persons?
Hello?
Yes, Francis, you're on air.
No, my name is Abraham.
Oh, Abraham, Winneba. Abraham, yes, talk to us. How is Winneba?
Yeah, Winneba is pretty well.
Great.
Yeah, so my what I'm saying is very simple. That people are saying that actually preparing a vaccine probably might affect the quality, but we must understand that things are changing day and day, and then we are in the modernized world, and the pace of which we do things keep on changing all the time. So the rush in preparing the vaccine, does not affect the quality. However, JoyNews, documentary in recent times on this road accident has revealed that so many people are dying. Even if you compare the road accident deaths as compared to the COVID-19 deaths, you can see that the road accident deaths is higher. So government should also pay much attention in addressing, those concerns, because so many people are dying as a result of road accidents.
Well, Abraham, thank you very much. Good point. Well made there. Abraham, joining us from Winneba. Well, see, if you are at home, if you had the first shot, and you have any questions on your mind regarding the shot you've had and when next you are to have the second shot, you can give us a call. The number is right there on your screen, 0302 211 691, 0302 211 691 or 692. So let me come back to our resource persons. And there's this question that I want to throw to all of you. I'll start with you, maybe Dr. Bediako, about any challenges. I mean, what are the challenges, if you can list them for us? Maybe 3 key challenges that we have faced in this process that we should learn from for the next one. But Doc, before I come to you, I have Charles calling from Medina. Let me do this one quickly. Charles, good morning.
Hello, Charles. Can you hear us? Do we have Charles on the line? Well, it appears we don't. He may have to reconnect. So, Gifty, please.
Yeah. Charles, try and call us back. Charles from Medina, try and call us back. Okay, I have Ebenezer, and Dr. Bediako, Prof, and Dr. Adumako Boateng. Pardon us as we take these calls from our viewers, because we want them to interact with you. Ebenezer, talk to us. Can you hear me?
Yeah, I can hear you.
Yes, please go ahead.
I want to find out from the resource person if there's a way of at least making the vaccine a tablet, like the HIV, having a tablet for the HIV patient.
You know, Dr. Bediako just laughed.
It got all of them laughing.
Yes. Ebenezer, your question just got all of them laughing. Thank you very much for spicing up our show. but that's a very interesting question. Eben, is that all so that we can get an answer? That's it?
But I want to contribute.
Okay, thank you very much,
his
Eben.
Contribution.
Okay, that's actually Charles from Medina.
No, Charles is now on.
Charles is now on. Okay, pardon me. Okay, so let's note that question, Docs. Charles,
hello.
Let's hear you. Please go ahead.
Yes, I want to find out when we are having the second shot. I've had my first shot and haven't heard anything about the second shot yet.
Okay.
Charles, do you have your card? I do
have my card.
Good. So usually it would be about a month from that point, but we've also been told that, especially as we're using AstraZeneca, it could be about 8 weeks. So just hold on to your card, and I'm sure where you vaccinated.
There's a date on the card.
Yes. They took your details, right?
They did.
Yes, so expect them to at least get back to you. But we'll get more confirmation from our guest. Is there anything else you'd like to find out, Charles?
No, I'm okay. Thank you.
Okay.
Thank you so
much. The number still remains 0302211691 extension 2. If you still have any concerns, you can sneak them in quickly. Back to you, Gifty.
All right, so let me bring in Dr. Bediako. Dr. Bediako, I wanted us to look at the 3 key challenges, but we can hold on to that as we answer the questions of our callers. He's asking, can we have a tablet instead of getting this? Is it possible?
Not at the moment. I mean, there are some vaccines that are taken orally. So the polio vaccine is one that obviously everybody is probably familiar with, where you put drops on the baby's tongue. Majority of the vaccines that we have available are injectable, and that is basically how they work. You have to, you inject them either into the muscle, and then the vaccine is taken up by cells in your tissue, and then that's how you induce the immune response. If you were to take it orally, most likely the vaccine will be destroyed in your stomach before it could do anything. So most vaccines cannot be administered orally. There is work, obviously, because there's a lot of needle phobia in the world. There is work to try to make less painful vaccines. But at this stage, with COVID-19, where even in many ways we are lucky to have a vaccine this quickly, we haven't, so I think, currently there is no other way. The HIV meds are not vaccines. They are medications. They are treatments for HIV. Okay. That's why they are taken as pills. It's not a vaccination.
All right. Before I go to Dr. Adumako Boateng on something to do with the speed, because that was a question posed, I think, by Majid. We skipped that one. John and Bolga, good morning.
Good morning, sir.
Okay, so briefly, what are your thoughts? What are your concerns?
In fact, I want to first of all commend Joy FM and JoyNews for their impeccable work done. In fact, we must acknowledge that. So, in fact, your show alone gives us a lot of education on this particular thing. Now, to my question, really, we don't really understand much on.
Oh, that's sad. That's really sad. That's why it's important when you get through to go ahead, make your point quickly before this happens. But since that happened, let's take Adams from Damfa. Adams, good morning.
Good morning.
All right, so hit the nail on the head.
The question I want to ask is that why is it then that if the shot for the second shot is delaying, why don't they give it to a company like Entrance Pharmaceuticals to work on it?
A company like?
They can get.
Is it a local company?
Yeah, Entrance Pharmaceuticals. It's a local company.
Okay, so you're talking about the local drive as far as the vaccines are concerned.
Yes.
Right. Let's finally take Josephine from Kumasi and then just patch the questions through to our guests. Josephine, you're live.
Good morning, sir.
Good morning.
Please, I'm speaking from Kumasi.
Right. What are your concerns?
Please, when I took the vaccine, I had some problems. I was having severe headache and running stomach. And I was very weak. I couldn't go to work the next day. So I want to know if it's a normal thing or maybe I'm having problem with my different thing that I have to take.
Okay. Josephine, thank you very much. So we have the speed question, Gifty, about someone feels, Majid felt that we were delaying in terms of the vaccination drive. Then we have this bit. So as far as, I think even this one I could, because the headaches,
but I think she's talking about having running stomachs. Maybe she must have eaten something that day, but we don't know. Let's leave it to the experts.
But that's also supposed to be one of the likely side effects for some people who take the vaccines. But let's get to
from the experts.
Dr. Adomako Boateng. So let's start with the speed question. Majid has a problem with the speed. He thinks we're not vaccinating enough. We're not doing it enough. What's your take on that?
Dr. Adomako Boateng.
Hello?
Yes. Dr. Adomako Boateng, did you get the question?
Okay, so but before then, I will also want to touch on the maternal mortality issues that were discussed earlier on.
Sure.
If you look at our data, Ghana Health Service, surprisingly, maternal mortality for 2020, we reduced it drastically, with a major reduction coming from Ashanti region and Greater Accra. Can you hear me?
Yes, please go ahead.
Hello?
Yes, we can hear you, Doc. Please go ahead. Doc, we can hear you. Go ahead. Go ahead.
Okay, let's throw this question to Prof. And let's get your thoughts on that while we wait. But I think that before we wrap up, let's...
Hello?
Yes, Dr. Adomako Boateng.
Can you hear me?
Yes, we do. Go ahead.
Okay. So I wanted to... The maternal mortality for Ghana went down drastically for 2020. But deliveries actually increased. But the maternal mortality really reduced. And a lot of other indicators also saw a reduction in terms of what we... But in terms of the speed at which we are going to go, I think we have a national plan. And as the president stated, by May, we are still expecting 2 million vaccines. And I think the plan is that those who are supposed to be vaccinated, we are actually going to follow the same schedule of how the plan has been. First of all, we are going to go for highly hit, and those who are at risk, health workers, the military, those with comorbid issues, the elderly. So that is the pattern that Ghana Health Service and Ministry of Health is going to, as and when we have, then we'll come and then give the jab. So we have a timeline as to how we are going to vaccinate the population.
Okay. Well, I have this question that I asked earlier. As we wrap up, I said I was asking all three of you, and I was going to start with Dr. Bediako. The three challenges that you've identified with our program that we should learn from going forward. I'll start with you, Dr. Bediako.
You mean the vaccination program?
Yes, please.
All right. I mean, I think the first challenge is vaccine access or supply. And that is not necessarily anything we can we can learn from it in the future. We have to start early. There were countries that were signing bilateral agreements very, very early in the COVID pandemic. I think we perhaps were a little bit slow to start those negotiations. And we've depended quite a bit on COVAX and the African Union. I think in the future, perhaps we will try to be a little, we'll try to have a little bit more diversity in the options that we have available. But I think in general, with a pandemic like this, I think currently we would say, we are stuck. The supply is going to be the biggest challenge. We are sort of at the mercy of suppliers and overseas. I think we should learn from this to improve our capacity locally. That is something that I know His Excellency the President has alluded to, that we need to build up capacity locally. So I think the biggest challenge is supply. And when you are dependent on overseas factors, overseas governments to supply you with the vaccine, you're always going to be at their mercy. So we need to become more self-reliant. Clinical trials need to be something that we embrace in this country. Clinical trials are not to be demonized. Clinical trials are safe. If we don't conduct clinical trials in our country, we really won't know how vaccines and other medical interventions work in our population. South Africa got vaccines much earlier than we did because they were the only African country, actually, and Kenya as well, to take part in a clinical trial. So I think Ghana we need to shake off this fear of clinical trials, this idea that we don't want to be anybody's guinea pig. I think that is a very backward kind of mentality. Clinical trials, if done properly, if managed properly, are very, very useful. And we have the capacity in this country to be a world leader in clinical trials, led by our own scientists, of course, not by other people. So I think clinical trials are important. And then finally, I think there needs to be good communication. We have learned that as we communicate better with people's adherence goes up. And I think you can give Ghana Health Service credit that as they have become, they've been very open with the vaccination process. And I think you see that it is bearing fruit. Okay. So we need to be open with the numbers, open with the with the communication. Right. Just finally, I just wanted to mention about the pregnancy. Just today, the US has released data showing that there is no risk to pregnant women who have gotten the vaccine. There are clinical trials that have been ongoing, and it's very, very encouraging. So just today, it's been released. Studies in Massachusetts and Boston have demonstrated in pregnant women that who have received the COVID vaccine, no risk to their baby, no risk to themselves. So hopefully that will feed into our own practice here, and very soon pregnant women will be added to the people who are going to be vaccinated. So I just thought I'd add that in.
Okay, so we have to go, but just to be fair, Professor Yorson, we're going to give you the last bite on that very bit. So your concluding comments, and then we shall call it a conversation.
The challenges, as we've seen, is with communication. Initially, it was stigma, then denial of the existence of the disease in the first place, and then vaccine hesitancy. But generally, I think we are doing well to overcome that challenge so many more people can readily access the vaccine. As Dr. Bediako said, one main challenge we need to, and we will encourage media houses to support us, is support for research in the country, local support. There is a bill in Parliament that seeks to establish a research fund, and it's been there for ages, God knows how long. These are key things we need to support as a nation. Get it out there so that we support local research and get things done. It's shameful that Africa at this stage is wholly at the beck and call of others to give us vaccines to use. So we need to start actively engaging our leaders on the support for local research and development of vaccines and other such important health issues.
Gentlemen, this is where we draw the curtains. Thank you very much for joining us for the conversation. We're very grateful. Dr. Bediako is an immunologist of WACBIP with the University of Ghana. We also have Dr. Fred Adomako-Boateng, who is Regional Health Director, Bono East, and Professor